The top 3 causes of death in people over 65 are heart disease, cancer, and stroke. Today we're going to focus on the #1 killer, which is heart disease. Heart disease can take many forms, but today we'll look at the top 3 most common types of heart disease that cause death in seniors. We'll also look at what you can do to prevent getting these diseases and what you should do if you already have one of them. So if you, or someone you care about, is over 65, then stick around. By the end of this video, you'll know what you need to do to help keep your heart healthy. And if you aren't a senior yet, you can use this knowledge to help you live a healthier life so that you can prevent heart disease when you get older. Coronary artery disease, sometimes called coronary heart disease, is the most common type of heart disease. It occurs when there is a buildup of plaque in the coronary arteries. These arteries supply blood to the heart muscle, so when they get clogged up, it can cause chest pain or shortness of breath, but it usually doesn't show any other symptoms. This can continue for years without you knowing it's happening. That's why it's often called the silent killer. Eventually, it becomes more severe, causing chest pain, pressure, or tightness, especially when you exert yourself. You may also feel lightheaded or nauseous. Damn. The most serious symptom is when you feel pressure or pain in your lower jaw, neck, or back, as this may mean you are having a heart attack. If this happens, call an ambulance right away. If you don't have symptoms, then there isn't really anything you can do to treat coronary artery disease. However, you can slow down its development by making some simple lifestyle changes. Quit smoking, eat a balanced diet low in saturated and trans fats and sugars, exercise regularly, and maintain a healthy weight. All these things will help keep your heart healthy. Heart failure is another common heart problem. It means that the heart isn't pumping as well as it should. When this happens, it makes it harder for the heart to send blood around the body, which causes fluid to back up in your lungs and other parts of the body. Fluid backing up in your lungs can cause shortness of breath and coughing. Fluid backing up in your legs can cause swelling around your ankles and feet. Other symptoms include fatigue and rapid weight gain due to fluid retention. Also, your heart may start beating faster, and you may feel it fluttering in your chest. Heart failure can be caused by coronary artery disease, high blood pressure, or other conditions. Once you develop heart failure, there's no cure. You can manage it by eating a balanced diet, exercising, keeping a healthy weight, and taking any medication prescribed by your doctor. Make sure to see your doctor regularly for checkups, so they can monitor your condition and adjust your treatment plan if necessary. Congestive heart failure is a type of heart failure where your heart is unpumping blood efficiently enough to meet the needs of your body. This means that blood can back up in your lungs, causing them to become congested with fluid. This can make it hard to breathe and lead to coughing. Congestive heart failure can also cause fluid to back up in your legs and ankles, making them swell. To diagnose congestive heart failure, doctors use several methods. They'll ask you about your symptoms and do a physical exam, listening to your heart for any abnormal sounds. They may also check your feet and legs for swelling. In addition, they may order tests like an electrocardiogram, chest X-ray, blood tests, or an echocardiogram. Echocardiogram is a test that uses sound waves to create images of your heart. It helps doctors measure how well your heart is pumping blood and check for problems like leaky valves or areas of the heart that are unpumping well. If you do have congestive heart failure, there are several things you can do to help improve your symptoms. See your doctor regularly and follow their treatment plan. Eat a balanced diet low in salt and sugar, exercise regularly, maintain a healthy weight, and quit smoking. All these things will help keep your heart healthy and reduce your risk of developing other heart problems. Atrial fibrillation is a problem with your heart's rhythm. Normally, your heart beats in a regular rhythm controlled by an electrical system. When this system malfunctions, it can cause an irregular and often very fast heart rhythm. This is called atrial fibrillation. People over 65 are particularly susceptible to atrial fibrillation because the electrical system of the heart can malfunction as we age. Atrial fibrillation can cause palpitations, a feeling that your heart is racing or pounding. It may also cause shortness of breath or fatigue. Most of the time, atrial fibrillation doesn't cause symptoms. Many people do and know they have the condition until they have a cardiac event such as a stroke. Atrial fibrillation increases the risk of stroke because it causes the top part of your heart to beat too fast and irregularly. This can cause blood to pool in your heart, increasing the risk of blood clots. If a clot breaks loose, It can travel to your brain and block an artery, causing a stroke. If you notice any unusual changes in your heart rate or rhythm, be sure to see your doctor right away. They can use an electrocardiogram to check your heart rhythm and determine if you have atrial fibrillation. If left untreated, atrial fibrillation can cause serious complications like stroke or heart failure. So it's important to seek medical attention right away if you think you may have the condition. There are several treatments available to help control atrial fibrillation and reduce the risk of complications. Your treatment will depend on the severity of your symptoms and other factors. Your doctor may recommend medications to help regulate your heart rhythm or blood thinners to reduce the risk of stroke. In some cases, they may also recommend a procedure called cardioversion, which uses electric shocks to restore your normal heart rhythm. With proper treatment, most people with atrial fibrillation can live full, active lives. Peripheral artery disease is another common circulatory system disease that affects seniors. It's a condition that occurs when there is a blockage in the arteries that supply blood to your limbs, usually the legs. This blockage can cause pain, cramping, or fatigue when you walk or exercise. PAD can also cause wounds that are slow to heal. In severe cases, it can even lead to gangrene. PAD is usually caused by atherosclerosis, the same condition that causes coronary artery disease and stroke. People who have diabetes or a history of smoking are at increased risk of developing PAD. There is no cure for PAD, but you can slow down its progression by making some simple lifestyle changes. These include quitting smoking, eating a balanced diet, exercising regularly, and maintaining a healthy weight. If you already have PAD, your doctor may also prescribe medication to help improve your symptoms. Stroke is another leading cause of death in seniors. A stroke occurs when the blood supply to a part of the brain is interrupted, depriving brain tissue of oxygen and nutrients. This can cause brain cells to die, resulting in permanent damage. There are two types of stroke: ischemic and hemorrhagic. Ischemic stroke is caused by a blockage in the arteries that supply blood to the brain. Hemorrhagic stroke is caused by bleeding in the brain. Both types of stroke can cause similar symptoms, including sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, dizziness, loss of balance, and severe headache. If you or someone you're with experiences these symptoms, call an ambulance immediately. Early treatment can help reduce the damage caused by a stroke. Treatment options include medication to dissolve blood clots, surgery to remove a blood clot or repair a damaged blood vessel, and rehabilitation to help you recover from the stroke. To lower your risk of stroke, you can make some simple lifestyle changes. Eat a balanced diet, low in saturated and trans fats and sugars. Exercise regularly, keep a healthy weight, and don't smoke. You should also see your doctor regularly for checkups. If you have risk factors for stroke, such as high blood pressure, diabetes, or a history of smoking, your doctor may recommend additional measures to lower your risk. There are many things you can do to keep your heart healthy as you age. By following the tips above, you can reduce your risk of developing heart disease and other chronic conditions. Remember to see your doctor regularly for checkups, especially if you have risk factors for heart disease. With a little care, you can keep your heart healthy for many years to come.